We're now live. You can begin.
Hello, everyone. Thank you so much for joining us. Before we get going, we'd like to start with a brief message from Gilbert Martinez for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mace. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias.
Thank you so much, Gilbert. I'm Linda Hopkins, Supervisor for Sonoma County's 5th District and the Chair of the Board of Supervisors, and we welcome you to our COVID-19 and vaccination update for Friday, January 29th. Our rollout of COVID vaccinations is continuing to accelerate in Sonoma County, and our healthcare partners have now administered just shy of 40,000 doses here locally. Our main focus today is to address some of the confusion that's surrounding who has priority to get these vaccines in our community, and also how to get an appointment, particularly concerning the new OptumServe site in Rohnert Park. We know that everybody is eager to get a vaccine, either for yourself or for a friend or for a family member that you're worried about. We understand, and we understand how anxious this moment is. Everybody is worried. Everybody wants that vaccine so that they can feel that sense of safety and relief. But the fact is, right now, there just aren't enough vaccines to go around in the county to meet demand. So we want to make clear what we are doing to help get the vaccines out in our community in an equitable way, and also what you can do to prepare or register to get a vaccine when it's your turn. Now that we've nearly completed vaccinations for our phase 1A, a population of healthcare workers, we are focusing on getting vaccines to our most senior residents. And for now, that means those who are age 75 and above. Now, why are we focused on this group while some counties are choosing to vaccinate those ages 65 and above? There are several reasons. Number one, unlike many counties, a significant amount of Sonoma County's population is actually made up of senior citizens. Overall, we have 102,000 people in our county who are over the age of 65. That's equivalent to more than 25% of our adult population in total. Given the small number of doses that the county receives directly each week, it's just not possible to vaccinate such a large group all at once. So given that, we are focusing instead on the 37,000 residents in the county who are age 75 and above. The other reason that we're focusing on this population is because they represent those who are most vulnerable to COVID. Roughly 2/3 of all the members of our community who have died of COVID during this pandemic have been residents who are 75 and older. We need to help them, and we need to get them the vaccines first. That is why we are asking for your patience as we set aside the first vaccine appointments for those in this group. We're also doing what we can to make sure appointments are available to those who lack the access or the skills to make appointments for themselves. We don't want them to be left behind. So we're actually personally calling. County staff are making phone calls to our most vulnerable residents of our community who might not have access to email or internet. And, I just want to say something from a personal note, which is that a friend of mine who's in the fire services, one of our local fire chiefs, very well respected, said to me a few weeks ago, this didn't really make sense to me until I started thinking about it as a mass casualty incident, right? With potentially 500,000 people who could be impacted by it. We have now lost more folks in Sonoma County to COVID-19 than we have to fires and floods. And we have to look at those fatalities and do everything that we can to prevent future deaths. In an MCI or a mass casualty incident, you have to go into triage mode. And in triage mode, you provide the services to someone who is most at risk of dying if you don't give them those services. And in mass casualty incidents, right, it's also a situation where you have a limited amount and an overwhelmed sort of system in terms of demand. And so I think that when we look at it through those lenses and we realize that the people who are older than 75 in our community are the ones who are disproportionately dying, are those who are at most risk of death from COVID-19, that absolutely makes sense to prioritize them first and foremost for the vaccine. So I know that it's frustrating for those who are still waiting for the vaccine, but I also feel like it is the right thing to do to take care of the most vulnerable members of our community, which are the people who are 75 years old and older. And now I'll hand it over to Dr. Shende to explain a little bit more about the OptumServe site and what happened and what the plans are going forward.
Thank you, Chairwoman Hopkins. Good afternoon, everybody. Yes, we recognize that there was some confusion about signups at our newest vaccine clinic, which opened on Wednesday at the Rohnert Park Community Center. This clinic is managed and operated by OptumServe and is one of just 4 clinics around the state that has been set up as part of a pilot project. We made clear from the beginning, when this clinic was first announced on Monday, that it was intended for a very specific group of people. And that was for people over the age of 75 who had disabilities, who also had less access to technology and also did not have medical homes and are from underrepresented parts of our population. Because OptumServe's scheduling application does not provide screening capabilities that we needed to ensure that these appointments went to those within the age group, we announced that the appointments were made by invitation only. As a result, we reached out, as Supervisor Hopkins mentioned, by phone to reach out through our adult and aging division and our health equity program to work with affiliated senior organizations in the community to target this very vulnerable population through an equity lens. This was successful for the first 48 hours, in which we were able to schedule more than 550 appointments for these people who otherwise would not have been able to access it on their own. During this time, we were able to ensure appointments went to these seniors. Unfortunately, the link for the signups ended up being circulated in an email and was eventually posted on social media. As a result, there was a rush to claim these appointments, which quickly filled up through the 3rd to 4th week in February. And during the process, we discovered that some people under 75 years old were able to schedule an appointment. Not just some. I just did the math. It was 85% of the appointments over the next 3 to 4 weeks were scheduled by people who were not in our intended vulnerable population. They were less than 75. This is not to say that people under 75 are not vulnerable as well. We understand that, but we really need to look at those who are over 75 and particularly those who have the issues, as mentioned before, who have disabilities, who have no access to technology, who really are our most vulnerable citizens. We've since worked with OptumServe to take the proactive step of notifying these individuals that their appointments have been canceled going forward because the clinic is not vaccinating those under 75 at this time. We did this to preserve these appointments as well as to save these individuals the trip of coming to the clinic. Since the clinic is checking ID to verify age, only those 75 and older will be able to attend, and those who are less than 75 will be turned away at this point. Once we finish vaccinating our 75 and older population, we'll prioritize other seniors, and those who tried to make appointments for the Rohnert Park Clinic will have an opportunity to reschedule. This is not very far off in the future. We hope to have a concerted effort to reach those over 75, and very soon those over 65 will have access as well. We're asking for patience. We've now posted the link to OptumServe's site to our website, socoemergency.org/vaccine, so everybody over the age of 75 has equal opportunity to get an appointment. The site is myoptumserve.com/COVID-19. We're still working to save some of these appointments for our most vulnerable seniors and those who are not able to make appointments for themselves. We're asking everyone who may be eligible, if you can mitigate your risk, we're asking you to wait and to be patient. The more we all help those over 75, the sooner we can get to those who are over 65 and the essential worker categories. Allowing our most vulnerable residents to be vaccinated first significantly decreases the worst health outcomes for them and for all of us. We also want to make clear that this clinic in Rohnert Park is going to be in operation for a long time. It'll be in operation for at least 6 months, so it's not going anywhere. So there will be plenty of time for people to schedule appointments. I'd also like to go over the details concerning some of the other sites that are in operation in our county, because there's been a lot of information over the past few days, and it's hard to keep track of what's going on, and I know people have a lot of questions. So many people have asked us how they can get appointments at these sites, but again, these two are intended for specific targeted groups and are operated by our partner groups, not by county health. At this point, these appointments are not open to the general public. These include the Public Health Lab with AMR and Fire Agency Clinic for first responders and law enforcement, Grace Pavilion, the Fairgrounds, Sonoma County Medical Association Clinic for healthcare providers to reach those in our Tier 2 and Tier 3 populations in Phase 1A. The Sonoma County Fairgrounds is the Safeway Clinic for in-home support services workers. The county administration building has a group called Clinical Health Appraisals for public health field workers. Roseland Library has intermittently had DEMA Consulting Clinic for community health promoters. The fitness center at the Santa Rosa Junior College Petaluma campus will have capacity for more than 300 vaccinations a day, and they're going to be partnering with the Petaluma Health Center very soon. Huerta Gym in the town of Windsor will have capacity for 300 or more vaccines per day, and this will also be targeted for those 75 and up. Once again, as we get through this population of 75 and older, we will soon be able to move into these other groups, and all of these sites will be available to other people. And once that ability to move into the next group is a possibility for us, then we will post these links on our website and make them available. Others that are coming and will be starting soon is Safeway Clinic for Seniors at the Grace Pavilion. This is going to be another targeted invitation to reach those that we haven't been able to reach through OptumServe in Rohnert Park. The Safeway Clinic in Oakmont is going to be operating next Thursday and Friday. I know many Oakmonters already received the invitation and have already signed up, but to be clear, we are going to have to restrict to over 75. And those who have received an appointment already will be receiving information on the fact that we are going to need to postpone these appointments. As many of you know, those appointments in Oakmont became available at about 10:30 this morning. And within about 2 to 3 hours, they're completely booked for Thursday and Friday and the following Tuesday, with mostly people under the age of 75. The Sonoma County Office of Education Clinic for Teachers at Rancho Cotati High School is going to be postponed until we reach the over 75 population. The Clinic for Food and Ag Workers at Amy's Kitchen was slated to start on February 8th. We will see where we are in our goal of trying to reach our over 75 and see when they will be able to start, as well as then move into the tier for essential workers. Finally, I want to call attention to the fact that the state has gone live with its new website at myturn.ca.gov, where people can register to be notified when it's their turn to receive a vaccine. But it's not yet capable of letting people in Sonoma County know how to make an appointment. This website was just released a couple of days ago. It's not fully operational and running and integrated with our systems. But over the next week, there should be an improvement in the system, and that will be one way of being able to identify where one might be able to make an appointment. The state says that Sonoma County residents can make appointments starting in February. We're eager to see how that will work. For now, we still encourage those residents who have insurance to go through their primary care provider to find out when and where vaccines will be available to them. Again, we know there's been frustration about this, but we can assure you that the big health systems are starting to reach out to their patients. And I've heard of many people who over the last 2 or 3 days received a phone call, were registered, and then were given appointments within a day or two. So please be patient, because this option is going to be available to many people over the next few days and certainly over the next week or two. Those who do not have insurance should go to socoemergency.org/vaccine for more information. The My Turn site will serve as a good backup for all of us. The site is posted in several places on the county's website, which is socoemergency.org/vaccine. One more note for people who realize that they end up with more than 2 or 3 options for an appointment, whether it be over 75 at Rohnert Park or at Oakmont or through your primary care provider's office. If you end up with 2 or 3 appointments, please be sure to cancel the subsequent appointments to make room for other people. We all have to remember to cancel so that we have more vaccine appointment availability going forward. Thank you, and we'll see you all on Wednesday.